Hey, what's up, YouTube? Uh, Coming here again with the 9 weeks post-op Supraspinatus full thickness tear on my right shoulder post-recovery on surgery. If you see my other videos, I've been keeping a record here, just documenting my progression. And so this video, I just kind of wanted to talk about where I'm at, some goals that I've achieved, and basically just overall progression. And if you're interested in that kind of thing and where you might be, whatever your timeline is or what week you're on, or if you're about to have a surgery, just some encouraging words hopefully, and we'll see. But we'll start off with my physical therapy has been going well, and I at 8 weeks started doing weights, and instead of assisted and other stretching and exercises, I'm doing resistance and using weights and doing weights when I'm doing lifts and other things like that, which is increasing my strengthening in my shoulder, which allows you to basically get your arm up where you need to get it. I can't tell you how long. I went 2 months before surgery and then 2 months after surgery where I couldn't do anything really with it. So 4 months of not using any of those muscles, they get sore really fast and it's hard. So strengthening those up, getting it to where I can use the arm basically. As far as range of motion, I can move it, especially with the pulley, I can put it almost straight up, but on my own I can't. I can get, this is pretty good. So you can see compared to last time, not bad. The sleeping is still not great. I still wake up around 4 in the morning, 5 in the morning, and have to walk around and maybe ice it again for 15 minutes before I go back to sleep. But I sleep flat. I don't sleep with any extra pillows or anything like that. I have actually, last night I slept a little bit on my stomach and was able to keep my arms a little bit flat for a short amount of time before I was uncomfortable and rolled over onto my side. So that's awesome for me. I normally would fall asleep on my stomach and then transition over, so it's a good sign, and I've been waiting to get to that stage, so good for that. Also, just sleeping in general isn't as bad. It just gets sore. It just gets sore from the gravity, I think, and just weird positioning, holding it too close or away. But I don't even use a pillow underneath there anymore. I just basically, sometimes I'll just tuck my hand between my legs or just kind of set my hand on the bed as I'm laying there. But if I lay on my back, then it's fine, but I can't lay on my back that long. I can't sleep that way. So so that's been better, but it's still rough, and I think that will be a long while before I'm sleeping through the night. Just from previous experience with shoulders, without even a surgery, I had a shoulder injury, and it took me a long time, and it wasn't even that bad. So what else? So I don't even have another doctor's visit for, I think, 4 more weeks or 3 more weeks. It'll be my last probably visit with him. I don't know how much more PT I actually have. I'm supposed to be going 3 times a week now, but work kind of prevents that, so twice a week. And like I said, he's pushing me. It used to be I would be there for like an hour, and now I'm there for almost 2. And it's because I'm doing all kinds of crazy stuff, and I'm doing stuff that I swear I don't see anybody else in the place doing, which is I'll be hanging from certain machines with my arm and then squatting down and letting it pull up, and he has me washing the wall with a towel just to get that muscle built up, and all the pulley exercises, and doing rows and curls and butterflies and stuff like that. And as hard as he pushes me and as much as it hurts, I think, and every time, it's awesome. I don't think I would be getting as much progression as I am without him pushing me that way, and it's helped a ton. So yeah, last time I had a goal set, and it was to get my arm straight outside. So I think last time I was maybe here. So let's see. So you can see here, this is straight out, and I can hold it at 90, no problem. That was my goal. And believe me, I didn't not work for this. I worked because I knew it was a goal, and I tried. And I do it without lifting my shoulder up. You can see there. So my arm is sitting there. I'm not lifting it and then pulling it out, which I've gotten better at. I can drop my shoulder, lift my arm. Not bad. Same going forward, you know, and you saw the forward motion. I can bring my arm all the way up. The difference here is this is my good, that's my other arm. I've got some work to do on that one. Get it fully up. When I'm on that pulley, I'm pulling it as hard as I can. It hurts, but I want to get there. I'm really trying to get that arm straight up. I want that full range of motion. I'll do what it takes. And I think my goal for next video, which maybe will be at 11 weeks, I'm guessing. So 11 weeks, I'm going to see if I can get this arm past and holding maybe at this angle here. And I want to see if I can get my vertical arm straight up. We're going to see on its own without me pulling on it or anything like that. So the other exercise I've been doing, which is really hard, is putting my arm behind my back and lifting it up. And I can right now, only on my own, barely get it barely to my butt. My other hand I can reach all the way up and put it on my back. This one, not so much, barely on my butt. So I'm trying to work that out, and I've been stretching that even more than 3 times a day, just because I really want it to get there. That's tight. That is tight. And sometimes during therapy, like yesterday I had therapy, he was having me pulling on his arm and doing some resistance that way, and I felt a serious twinge there, and it scares me. Every time I feel that, it feels like the sharpest pain right where the surgery was, and that scares me every time. But, you know, the next day, here I am, no adverse effects. Again, I'm still not lifting any heavy weight or anything like that. I can only lift maybe a glass filled with something or a plate or whatever else. But I use my hand for everything. I've been shaving. I shave my head, you know, so I shave that with this hand, and I try to do everything with that. So there's still hope. And if you're watching these and you're getting anything from them, you know, just following along with the progression. Remember, mine was a full thickness tear, and it was big. My tendon had pulled way back underneath my collarbone, so they called it a large full thickness tear. And so they had to pull that back down and suture it up. And at 9 weeks, doing good. Way better than I expected. After the first few weeks, I thought I was going to be miserable, and 6 months before I could do anything. And now I'm doing stuff. I tried to play ping pong with my right hand, and it got tired after like 4 hits. It wasn't pain, it was just tired. And I had to switch back to my left. And I'm actually really not bad with my left, so it's not too big a deal. But I try to do more, and we're getting there. So let's see, is there anything else? Icing, again, I still only do that after therapy and at night. So and ibuprofen I only take maybe once a day, if that. Sometimes I don't take it at all. Well, I probably should take it more. The inflammation, when I feel like it's tight and hot, I should take it more. I'm going to pause this. But I don't take it, and maybe I should take it at least once a day or twice, just to help the inflammation. But as it goes, my progression is good, and I couldn't be happier. Everything's great. I feel like $1 million compared to what I was like a few weeks ago. So in another 2 weeks, we'll see you then. We'll set some goals. Hopefully you're setting goals. If you're in these positions, set some goals for yourself, because the minute you start setting goals and you want to reach them, at least for me, it eggs me on. It makes me want to do it. So I really want to get that full rotation. So until next time, good luck.